We're very, very glad that you're here, and there's a ton to cover this week. And before we dive in, I'm pleased to introduce our two excellent guests. First is Molly Woods Drake. She is the co-founder of Encinitas for Equality, a grassroots organization that was created as a direct result of the murder of George Floyd by police. Molly is an East Coast native who's lived in California for 12 years and has made a home in Encinitas 6 years ago. Raised on a picket line and in community town halls by two community and labor organizers, Molly has always been active in the social justice movement and has worked as a union organizer for healthcare workers with SEIU UHW for 12 years. In response to the murder of George Floyd, Molly and four other community activists created a memorial for all Black lives lost due to police brutality at the Cardiff coup. The momentum of the community showing up in the hundreds each night at the Cardiff coup protests, and I was honored to go to two of them, fueled organizers to create Encinitas for Equality. Molly and her fellow co-founders, Felicia Rollins and Jody White, along with a diverse team of 15 local leaders, continue to lead on the long overdue work for racial justice in their backyard and beyond. Molly, thank you for joining us. And for those tuning in for the first time, we are delighted to welcome back Dr. Andrea Lacroix. Great to see you. Dr. Lacroix is a distinguished professor and chief of epidemiology in the Department of Family Medicine and Public Health at UC San Diego. She's also the director of the Women's Health Center for Excellence at UCSD, and she's an expert on long-term observational studies and randomized clinical trials to identify preventative interventions that improve our prospects for healthy aging. She received her doctoral degree in epidemiology from the University of North Carolina at Chapel Hill. Again, welcome, Molly, and welcome back, Dr. Lacroix. And Dr. Lacroix, I've counted, this is the fourth virtual town hall that you've joined. So we're incredibly grateful for your taking the time to educate our constituents on all the latest public health data with regard to COVID-19. And what I thought I would do this week before getting to our speakers and your questions is providing an update on a number of things. And I'd like to start on where we stand with police reform. I stand with millions of Americans across the country demanding accountability and comprehensive reform to a system that has allowed brutality and injustice against people of color for generations. As I said, following the murder of George Floyd, only real reform will allow real healing. And I was proud to join my colleagues in passing the George Floyd Justice in Policing Act of 2020 recently. And specifically, that bill would do a number of things. First, prohibit federal, state, and local law enforcement from racial, religious, and discriminatory profiling. Mandate training on profiling for all law enforcement. Ban chokeholds, carotid holds, and no-knock warrants at the federal level. Limit the transfer of military-grade equipment to law enforcement. Mandate the use of dashboard cameras and body cameras. Establish a national police misconduct registry to prevent problematic officers who are fired or leave one agency from moving to another jurisdiction without any accountability. Amend federal criminal statute from a willfulness to a recklessness standard to successfully identify and prosecute police misconduct. Reform qualified immunity so that individuals are not barred from recovering damages when police violate their constitutional rights. Establish public safety innovation grants for community-based organizations to create local commissions and task forces to help communities to reimagine and develop concrete, just, and equitable public safety approaches. Create law enforcement development and training programs to develop best practices and require the creation of law enforcement accreditation standard recommendations based on President Obama's 21st Century Policing Task Force. Require state and local law enforcement agencies to report use of force data disaggregated by race, sex, disability, age, and religion. Improve the use of pattern and practice investigations at the federal level by granting the Department of Justice Civil Rights Division subpoena power and creating a grant program for state attorneys general to develop authority to conduct independent investigations into problematic police departments. And finally, the Justice in Policing Act establishes a Department of Justice task force to coordinate the investigation, prosecution, and enforcement efforts of federal, state, and local governments in cases related to law enforcement misconduct. Just yesterday, I had a productive dialogue with local civil rights leaders and law enforcement officials, and I'm encouraged that Congressional Black Caucus Chair Karen Bass and Senator Tim Scott have continued to negotiate, because while the Senate's bill on this matter didn't go nearly far enough, I do believe that we still have the potential for a bicameral bill that we can pass into law this year. And that's what we've got to fight and work towards. This is not a moment to waste. And I'll continue to drive that point home with House leadership and my colleagues on both sides of the aisle in every way that I can. Also recently, I co-sponsored the Juneteenth National Independence Day Act, which would create a federal holiday to recognize and to celebrate the ending of slavery in the United States by adding Juneteenth to the list of federal holidays. And I also co-sponsored the Confederate Monument Removal Act, which would remove all statues of people who voluntarily served the Confederate States of America from Statuary Hall in the nation's capital. My great hope is with these actions and other measures, we can use this opportunity to whatever extent possible to reaffirm that Black Lives Matter and to create a new normal. And Molly, I'll be turning it over to you in just a minute. But before that, I wanted to update our viewers and listeners on COVID-19. First, I wanted to thank all of our frontline workers. Actually, I'm in Solana Beach at our office here right now. And before I came down here, I stopped at Tri-City Medical Center in Oceanside, and I dropped off about 225 ice cream bars to the frontline medical workers there. We're so incredibly grateful for their putting their health and safety at risk to protect the health and safety of others. But it is a tragic time for the nation. Sadly, we've now passed 134,000 lives lost due to COVID-19. We're all shaken by that statistic and prayerful for all the families that are impacted by this. In California, we know that we've got now over 313,000 cases. That's out of the 3,225,000 cases in the United States. Here in California, we've had 6,965 deaths. In Orange County, we've now had 22,650 cases and 412 deaths. San Diego County, 18,863 cases and 420 deaths. And perhaps most concerning to me is that over the last 2 weeks in Orange County, we've had roughly half of those cases, 10,690. San Diego during that same time has had 6,462. We are certainly seeing a spike in both counties, but particularly in Orange County. And that's despite the fact that San Diego County has been consistently testing more people than Orange County. The comparative low rate of testing in Orange County has been something of great concern to me for a number of months, and it continues to be, particularly among asymptomatic people in high-risk environments such as nursing homes and our other frontline professionals. Governor Newsom, as you probably are aware, has embraced a targeted approach, shutting down bars, movie theaters, other indoor gatherings, and encouraging outdoor options for dining. And there are cases now, such as in Imperial County, where he's gone further. And I would just encourage everyone again, I hope that it doesn't need to be said too much more, but just do the simple things that we know will help prevent community spread. Wear a mask, socially distance, wash your hands, prioritize outdoor spaces over indoor spaces, don't touch your face, et cetera, et cetera. The things that we know will help limit community spread that really at the end of the day are not that difficult. And we've got to work together and we've got to act in the best interests of our community. It's about basic respect for one another and basic common sense. As I mentioned in our past 29 virtual town halls, we've been working on a number of things in Congress over the last several months to deal with COVID-19, starting all the way back on March 6th when we passed our first $8.3 billion bill on the development of a vaccine. And I'm encouraged by a lot of what I've seen with over 160 companies and counting working very hard on that vaccine. But it's not going to be here tomorrow, next week, or next month. We're going to have to take this into our own hands and be personally responsible for wearing those masks, socially distancing, and following those rules for the months ahead. March 18th, we passed a $200 billion bill called the Families First Act, for emergency sick leave to help support nutrition assistance in the SNAP program and to support Medicaid. Then at the end of March, of course, we passed the CARES Act, over $2 trillion in funding, direct cash payments, expanded unemployment insurance. The expanded unemployment insurance ends at the end of this month, the end of July. So incredibly important that we consider where we are and we move forward accordingly. We cannot take our foot off the gas now, knowing that we're still in the middle of a very difficult time for so many millions of Americans who are out of work, whose businesses are unable to reopen because of the resurgence of COVID-19. So we've got to act accordingly. Of course, we also had the CARES Act. That was where we had the Paycheck Protection Program. We initially funded it with $320 billion. We had another $350 billion, total of $670 billion for that program. What I wanted to say about that program is there's good and there's bad. The good is that over 20,000 businesses in our district have received funds under the PPP program. Many of them desperately needed those funds. Over 200,000 employees district-wide in California's 49th have been assisted by PPP loan funding. The bad, obviously, is the lack of transparency and accountability with regard to many PPP loans. I am troubled by many of the stories of who received those funds. We have to absolutely make certain that only those businesses that truly need those funds or those that receive those funds, we're going to do everything we can from the perspective of oversight and accountability in Congress in the weeks and months ahead to make sure that that's the case. Over a month ago, we passed the HEROES Act in the House, and we actually sent it to Mitch McConnell, where it has been sitting collecting dust on his desk for over a month. Critically important, it has $875 billion for state and local governments. Our local economies have been devastated as a result of COVID-19. And in particular, with this administration talking about reopening schools or demanding that schools reopen, that costs millions and millions and millions of dollars per school district. If it can be done safely at all, it's going to be very costly. So we shouldn't be cutting funds for our state and local governments, cutting funds for our schools. At the same time, we're asking them to do far more as it pertains to reopening. It also included, the HEROES Act also included $100 billion for low-income renters, hazard pay for our frontline workers, $25 billion for the United States Postal Service. Now, that is so important for a variety of reasons. One, 630,000 Americans work at the USPS, including over 100,000 veterans. So if we care about veteran employment, which I very much do, we need to fight for the USPS. Also, 48% of all the mail in the world goes through the United States Postal Service. So important that we protect the USPS. I was really honored to lead an effort with 137 of my colleagues demanding that we provide them a lifeline. This has been a very, very difficult time financially for USPS. And look, we're still in the midst of a health crisis, and there's no way we can solve the economic crisis unless we solve the health crisis. In other words, you cannot have a healthy economy unless you have healthy people. So we have to emphasize the science. We have to focus on the advice of the epidemiologists and the public health experts like Dr. Lacroix, and that's why we have her here this week and every week. That's why we want to listen to our public health experts. A couple other things. I wanted to highlight some local environmental issues. At the end of June, I announced that the U.S. Department of Transportation had awarded $11.5 million in funds for the Del Mar Bluffs. This is so critically important to stabilize our bluffs. The rail corridor between Los Angeles and San Diego is one of the busiest and most important in the United States. And these funds will go to help install subsurface drainage, concrete channels, storm drains, and support piles. In addition to that, we were able to help secure $300 million as part of the new U.S.-Mexico-Canada trade agreement to help clean up the pollution at the Tijuana River Valley. There was a 60-minute story on this very recently. It's well worth checking that out if you haven't seen it. This is a huge and critical issue for our communities throughout Southern California. And I'm really, really happy that we were able to get the $300 million. Now we've got to work with the U.S. EPA to make sure that it is used quickly, effectively, and efficiently to actually deal with those problems that exist at the border. We're also working with the U.S. Army Corps of Engineers, and we received planning, engineering, and design money for two important coastal protection projects, one in Encinitas and Solana Beach, and another in San Clemente. We're going to keep working to preserve and protect our coastline. Along those same lines, we just released our report on the San Onofre Task Force. The San Onofre Nuclear Generating Station, of course, is right in the middle of our district. 1,600 tons of spent nuclear fuel that we've got to get off the coast as quickly and as safely as we can. I brought together a wonderful group, a task force, co-chaired by the former head of the Nuclear Regulatory Commission and a retired Navy admiral. They made a number of great recommendations, and we'll be taking the appropriate federal actions in the months and the years ahead. Our first action was the introduction of the Spent Fuel Prioritization Act, which says for all the nation's nuclear waste, prioritize moving the waste from those sites with the highest population density and the highest seismic risk. And not surprisingly, we rank at the very top with earthquake faults and 9 million people within 50 miles of San Onofre. In addition to that, I'm very proud that we just released the new Select Committee Climate Crisis Action Plan. I serve on that Select Committee, and it's a comprehensive document, 538 pages of how we get the United States to net zero carbon emissions by 2050, the power sector to net zero by 2040, and all new zero emission vehicles by 2035. I'm really proud that a number of my bills were included. I believe 7 of my bills were included in that report. And it's the most comprehensive plan that the United States Congress has ever released to try to finally deal with the climate crisis in a way that is commensurate with the science. So I'm very, very proud of that work. And we're just getting started, obviously. It'd be very, very helpful if we had an administration and a White House that actually wanted to follow scientific advice and consensus with regard to climate change. But that'll come hopefully soon enough. I did want to mention 2 bills for our veterans. I chair the Veterans Affairs Subcommittee on Economic Opportunity. I was very honored that yesterday we had a great virtual summit with a number of our veteran service organizations and other leaders in the community, specifically talking about veterans' mental health and prevention of veteran suicide. We also just recently introduced 2 bipartisan, bicameral bills that I think have a great shot of becoming law. One is the Homeless Veteran Coronavirus Response Act. Second is the Veterans Economic Recovery Act. Tragically, the veterans' unemployment rate, which was all the way down at 3% pre-pandemic, is now up around 12%. And the bill that we introduced would provide a new 12-month rapid retraining program in those highest demand occupations for our veterans. And I'm very, very excited that we might be able to help tens of thousands of veterans with that bill. We're going to keep working on a bipartisan basis for our veterans, and that's been some of the most rewarding work that I've done in my time in the Congress. So there's a lot more going on. We've got a ton of questions, but with that, I'd like to turn it back to our guests and begin with Molly. And I was so pleased to attend 2 of the peaceful protests that you helped to organize in Cardiff. And I'd be grateful if you could just share a bit about yourself and a bit about what led you to organize those protests. Molly, the floor is yours.
Great. Thank you so much for inviting me to join you today, Congressman Levin, and for your leadership in Washington, D.C. on behalf of the Movement for Black Lives, as well as the work you're doing for COVID-19. And Dr. Lacroix, it's a pleasure to meet you and get to be with you here as well. As Congressman Levin mentioned, my name is Molly Woods-Drake. I'm one of the co-founders of Encinitas for Equality and a resident of Encinitas. Like many of you who live within the 49th district, I immediately fell in love with the area when I came here. The proximity to the ocean, the welcome feel of a small town, and knowing my neighbors, as well as my ability to work as the union rep at Tri-City Medical Center for SEIU United Healthcare Worker, were all things that drew me to the area. However, growing up on the East Coast, living in Oakland, Los Angeles, Washington, D.C., coming to a community that lacked diversity was definitely something that I've struggled with. And while my upbringing career background has always been in social justice and the fight against racism isn't new, like many of us, something broke in me when I watched George Floyd's life be taken from him by the knee of someone who had taken an oath to protect him. And so as a result of this, I and other community members sought a way to do anything in our community to call for justice. That something began with 5 women coming together and creating an art installation with hundreds of names of the lives that had been taken by police brutality. Overnight, it turned into hundreds of residents that came together at that vigil day after day to protest against these murders and for justice. And Congressman, again, we thank you for joining us at the vigil for 2 of those evenings and for your leadership. In the weeks following the murder of George Floyd, we lost more. Tony McCade, Rayshard Brooks, the names went on, and we kept adding them to our boards of names. And we recognize that names do not stop, neither can the work that needs to be done. And so we decided that Encinitas for Equality would not be a moment in time, but rather that we would establish ourselves as a local nonprofit and would join the movement for Black lives and all who live each day in that fight for equality. It's the goal and mission of Encinitas for Equality to elevate the 0.8% of Black people that we have living in our coastal communities, to support existing organizations that have been leading on racial justice and equality for decades, and build a community that fosters, supports, and protects diversity. While the pathways to justice are countless, we have focused on 6 subgroups that are the foundation of Encinitas for Equality. Our education subgroup focuses on evolving our school-based education systems and the curriculum, as well as educating our community who want to work together in allyship. Our community division the mission is to work in allyship with our existing Black communities that are just right around the corner, and share collective experience, host gathers, and build supportive relationships. We believe that the end to racism begins with just a hello. Policing, our policing and criminal justice team is focused on reimagining what policing can and should look like, as well as reforming our criminal justice system at large. Our housing and business team is focused on the lack of affordable housing that we have within our communities, as well as the fact that we have no Black-owned businesses in Encinitas. This is a major flaw in the system, and it's why we do not have diversity in our backyard. Our youth group, our Black youth in Encinitas have unfortunately received the most oppression and racism. We have heard from Black youth, horrible stories of racial slurs within their classroom, as well as police brutality that has happened at our beaches, in our backyards. These brave Black students, 3 of them, are leading on this, and we are empowering them and giving them the platform to change their school system, have a Black student union in every one of the school systems in the Encinitas school district and beyond. And then, of course, our electoral group, because we know that all of the above is dependent on having allies like yourself, Congressman Levin, in elected positions. And our electoral group will focus on all areas of political work. I also want to know that my career as a healthcare labor union rep has highlighted what many of us have already known. We cannot have racial justice without also having healthcare justice. Our Black and brown communities are dying from COVID at 2 to 3 times the rate of our white communities, and the color of one's skin should never determine the type of healthcare that they receive and the longevity of their life. Furthermore, the poor decisions by the current administration and its colleagues in the Republican Party to 1, never fully close states and cities down, and to 2, open industries before it is safe, disproportionately affects our minority populations who often work in the service industry. It is my professional belief in the healthcare field and fighting for workers' rights, as well as the belief of Encinitas for Equality, that until we address economic, healthcare, educational oppression, we will never be able to adequately address racism as a whole. I'm grateful again for your leadership, Congressman Levin, and all of these areas, and your invitation today to discuss the work of E4E, and look forward to continuing to work together on this. Thank you.
Well, thank you very much, Molly. Thank you for your leadership and for those powerful words. I had just a few questions for you to expand on that just a little bit. Is the work of E4E solely focused on the movement for Black lives, or is it broader than that?
So what we currently recognize, and I think what everyone is beginning to recognize, that there are significant and vast areas of inequalities that affect many, many different groups. But I continue to use the analogy that if houses are burning right now, the house of our Black lives is burning the fastest and the most ferocious fire. And so our goal is to initially begin the work with the movement for Black lives, focus primarily on this. And we believe as we lift the communities or Black communities, the other communities that are also negatively affected will be lifted as well. As we become more established, our goal is to support the Latinx community, the LGBTQI community, as well as anyone who is facing inequality within Encinitas or organizations working on this.
Can you share some examples of the work you're doing in a couple of the subgroups that you mentioned in your opening statement?
Yes, so I would say the most visible work we're doing is within our community group. And so we are currently Sister Cities organization led by Sean, who lives on a beach. And that is big. We will be having an event on July 25th, pending what we hear about coronavirus and where we're at with that. But we will be inviting National City and all the cities with more diverse population to come to Moonlight Beach. We'll be hosting an all-day event where we can actually begin to build these relationships and get to know our neighbors. We'll be hosting a yoga event, surf lessons, as well as inviting Black vendors, Black food vendors, and musicians to come and share their culture with us, because we believe that's where that work really begins. And our education group is currently working to get on the school board agenda, where we will have our Black youth be speaking about the importance of having Black student unions so that they can connect with people who look like themselves and they don't feel as isolated as they currently do within their school system.
And Molly, you partially answered my third question, but is E4E solely focused on and made up of Encinitas issues and residents, or are you looking to expand?
So what we recognize is that our coastal community, Encinitas specifically, has a very unique position in what's happening right now. When we only have 0.8% of Black neighbors, that's a problem. And that's something that has a different experience than what's happening in National City, for instance. And so a lot of our work is focused in Encinitas, but we have leaders from Solana Beach, from Carlsbad, and really what we hope is to create a program that could be replicated in communities that look like ours and made up of similar demographics, but communities that we think will benefit from the work that we're doing everywhere. And so we invite people from all areas to come and join our organization, and there is no limit to the work that needs to be done and the assistance that we need to make this happen.
Well, thank you so much for sharing more about E4E and for all that you're doing. Please stick around because we've got a number of questions that you may want to weigh in on. I wanted to turn it now over to Dr. Lacroix. It's great to see you, Doctor. What a crazy week it's been in terms of COVID-19. The case numbers are way higher than we'd like. Hospitalizations are up. So many signals that things are not going as we'd like. I'd love to get just your opening thoughts and comments on where we are and kind of what we need to do next to get this back under control.
All right. Well, let me first start by saying hello to Molly and saying how privileged I feel to have you as a neighbor. My sister's a union leader in New York City, and so I will think of you as my Encinitas sister if you'll let me. And I hope it'll be easy to find the information to your events so that we can all support them. I just wanted to start, Mike, you've already given us the numbers in Encinitas and Orange County. I wanted to start by showing you this graph again. This is from the San Diego Health Department website. When I first met with you, maybe it was a couple months ago, this line is the percent positive rate. This is June. What I'm going to do here is convince you, I hope, that our behavior is directly responsible for what's going on with COVID. So this nadir here, we were down below 3% positive test rate. On June 12th, I think under serious pressure from our county supervisors and other contingents, San Diego opened bars, gyms, museums, and other businesses like movie theaters. And you can see what happened just since that time in the infection rate, which is now hovering around 6 to 7%. At least we're keeping track of this. At least you can go to the San Diego website, Health Department website, and see this every single day. When you go to the Orange County website, you see this. There's some numbers here, and you have to do the math yourself. So fortunately, I know how to do math. And I'm going to tell you that I just divided the number of positives in Orange County from the numbers they're posting here, 1,133 positive tests in Orange County on the most recent day. That's a lot of cases every day. They did 7,300 tests, so that's good. That's more than the last time we talked about this. And if you divide those two numbers, you get 15.4% positive, 15.4%, double what we're getting in San Diego County. I wanted to say let you know that the 14-day growth in COVID cases is everywhere in District 49, and it's impressively elevated. So in San Diego County, up here in our district, we had in La Costa an increase of 140% in the last 14 days. In Carlsbad, an increase of 130%. San Marcos, 118. Cardiff, 116. These are more than doubled case numbers. Ocean Beach, well, that's further south. I think I'll stop with that. Every single community in San Diego County that got reported on has more than doubled in the last 14 days. So you can see that our behavior is directly related to what's going on with the COVID pandemic. And the last thing I wanted to tell you about is things that influence our behavior besides the truth. So in the last few weeks, there's been a new paper posted by the National Bureau of Economic Research entitled Misinformation During a Pandemic. And what these four, I assume, economists did was they conducted a study to examine the effects of misinformation on pandemic-related behavior. And since little was known about COVID at the start of this pandemic, and we still know way too little, accurate information has to be gotten by all of us from the news in real time. And I'm sure we've all spent hours hoping that we're hearing the truth from the news programs that we're watching. They also studied the consequences of misinformed behavior for individuals' health and society and for our healthcare system as a whole. And they did this by comparing people who watched two of the most widely viewed cable news shows in the United States, Hannity and Tucker Carlson, both on Fox News. So these two shows took very different stances on the risks associated with COVID-19. While Hannity downplayed the threat during the initial period of the virus's spread in the United States, Tucker Carlson tonight warned its viewers that the virus posed a serious threat as early as February. In this paper that's been released, these economists show that differential exposure to these two news shows affected behavior and downstream health outcomes. Hannity's viewers changed their behavior in response to the virus much later than other Fox News viewers, while Carlson's viewers changed their behavior earlier. They then documented in this paper that greater exposure to Hannity relative to Tucker Carlson tonight increased the number of total cases and deaths in the initial stages of the coronavirus pandemic. And through a series of robust analyses, including, I'm happy to say, epidemiologic models being fitted to the data, they provided additional evidence that misinformation is an important mechanism driving the effects in the data. These results indicate that the provision of misinformation on mass media can have significant societal consequences. Lying causes deaths in the pandemic. We cannot reduce the pandemic by listening to lies. So that's my opening statement.
Well, thank you so much. I try to stick to the PBS NewsHour, so I don't know. It's not always the most exciting show, but I think it is generally accurate and honest. We've got a ton of questions. I want to get through as many of these as we can. We'll start with Sue in Dana Point. Sue says, can you tell us about the infrastructure bill that was passed last week when you're in Washington? I think it was 2 weeks now. Yes, I'd be happy to, Sue. The Moving Forward Act is something that we've been working on for my entire time in Congress. H.R. 2, it's about $1.5 trillion bill. I'm really thrilled to have gotten a number of my bills and amendments as part of the Moving Forward Act, including $3.4 billion for veterans infrastructure, so for our VA facilities, many of which really do need the help in prioritizing the service-disabled veteran-owned businesses in terms of helping to create and complete many of these projects throughout the VA. But a number of things that I included that others wanted to see, it all really leads to creating jobs right now and the importance of public works in helping our economy to recover from this huge problem that we're seeing. Don't be mistaken by these Bureau of Labor Statistics numbers. The jobs numbers are encouraging, but also a little bit outdated and not fully reflective of the total picture. The total picture is we're going to have to put millions and millions of Americans back to work. And recently I had a chance to watch another PBS documentary on the Roosevelts. Watched it again, and there was an episode that really struck a chord with me where FDR was inheriting this economic mess and had to figure out what to do. And they did things like the Civilian Conservation Corps, and they invested a great deal in public works. They put millions of Americans back to work, and we were able to recover in time from the Great Depression. And I think our generation now has a decision to make whether we want to be the Franklin Delano Roosevelt of our time or we want to be the Herbert Hoover. And I think it's fairly easy to make that argument that we don't want to be the Herbert Hoover, we want to be the FDR. So I hope we can come together. I hope that the administration will not just talk about infrastructure, which they've been good at, talking about it, but actually doing something. Want to work with us, want to bridge the gap, no pun intended, between our two parties and between their goal of $2 trillion in infrastructure and the $1.5 trillion bill that we just introduced very recently and passed in the House. So now the ball is in the president's court to move forward and hopefully to work with us on a plan in the months ahead. Here's a question for both Dr. Lacroix and for me. This is from Jonathan in Del Mar. Jonathan says, I'm distressed by the Republican administration leaving the World Health Organization. Dr. Lacroix, how does this affect us from a medical perspective? And Mike, what can Congress do about it? Doctor, I'll start with you if you want to address the WHO.
So depressing, so depressing. Was very distressing to learn that the Trump administration sent on behalf of the United States a letter notifying the United Nations this past week that we are giving notice to leave the World Health Organization, starting the formal process of withdrawal from this international, beacon of health around the world. So that letter was sent on July 6th. And I'm hoping Mike and our Congress can stop it, but I don't know. Fortunately, it doesn't take effect for an entire year. The withdrawal, if it were to happen, would jeopardize our access to life-saving COVID-19 vaccines, potentially. Given that vaccine manufacturing capabilities within the U.S. are limited, to withdraw from the organization at this stage in the COVID crisis, when we're on the cusp of developing a safe and effective vaccine and thinking about how to distribute it, would be a dire mistake. And that's the opinion of a law professor at an American university, and I agree with it. Cooperation from other governments is necessary to plan effective responses to public health crises, not just COVID-19, but so many other things. COVID-19 has, though, shown how political sharing of public health information can be. Many governments are reluctant to share information, particularly if they don't see eye to eye with the United States. And now so many more countries will come to the belief that they don't see eye to eye with the United States. The CDC depends on the WHO to broker global information sharing. We wouldn't have even known what was going on in Wuhan without our involvement in public health worldwide, including through the WHO. This global information sharing provides epidemiologic data needed to prepare health systems for the consequences of epidemics and pandemics that are always coming and going. And I want to also convey that an important point made by Dr. Garfien when this happened last week. The benefits of participation by the U.S. in the World Health Organization are much bigger than just COVID-19. There are a myriad other infections, HIV, TB, viral hepatitis, cholera, malaria, dengue, Zika, Ebola, the list goes on. And non-communicable diseases, asthma, cancer, heart disease, kidney disease, mental health, accidental injuries that the U.S. and the rest of the world face on a daily basis. We gain so much benefit from having a seat at the table in the World Health Organization, which has a direct impact on our ability to anticipate and respond to emerging and re-emerging threats. So we absolutely must, as Americans, demand that we remain in the World Health Organization.
Well, I think that's very well said, Dr. Lacroix. You know, what I would add is that if the administration doesn't like what the WHO is doing, they ought to try to push them in a better direction, not run away. I think we're ceding our global leadership on public health, and it's very, very concerning. What I can just also reiterate is that this decision doesn't take effect for a while. The election will be in November, and perhaps we'll have a different administration that will recommit the United States to be part of the solution for global public health again. Also, I think the House, during the appropriations process, is going to be taking measures to hopefully stifle some of these efforts, as I don't think they're in the best interests of our nation or really of global public health. So my hope is that calmer heads will prevail on this, but your points are certainly well taken, Dr. Lacroix. And here's another question for you from Suzanne in Vista. Suzanne says, when I ordered a mask online, it was delivered with filters with the letters PM 2.5 on them. Are these safe? Should I be breathing through these filters? Are they reusable?
Well, thanks for that question. Those of us who've cruised Amazon for masks, you'll know perhaps what's being talked about here from seeing these pictures that Suzanne's talking about. They're little white masks, kind of flat things that you can slide into other masks, and presumably they filter out more particles than the masks themselves. I did want to explain that the PM in the PM 2.5 stands for particulate matter, also called particle pollution. We talk about PM 2.5 all the time when we study the effects of pollution on our health. And this is a term for a mixture of solid particles and liquid droplets found in the air. They can include things like dust, dirt, soot, smoke, anything. And just to give you an idea of how small, so the 2.5 is actually a micron measure. So we're talking about very, very small particles. To give you an idea, a human hair is 50 to 70 microns, and we're talking about 2.5. So just a teeny tiny particle. But these things in the air do affect health, and viruses are part of that. There's also PM10, which are 4 times bigger particles. But a filter that filters out PM 2.5 ought to be taking out of what you breathe these very small particles. Whether or not they're reusable, so what you're going to have to check what you actually bought. I think if they are disposable type PM 2.5 filters, they may be reusable for up to something like 60 hours. I don't think they're washable in most cases, but you'll have to ask the manufacturer of what you're wearing. And I can also contribute from the literature that the cloth pocket with replaceable active carbon filter inserts may work better than the mask alone, but it's not officially being recommended because it hasn't been studied. And even after COVID is over, you can get benefit from wearing masks like that when you're in polluted and dirty environments. I also wanted to just mention the KN95 masks that you see online now. These are like the N95 masks, but they meet an Asian standard instead of the American standard. So they meet a Korean and Chinese standard. They're made in China, like most of our masks are. They filter out 95% of particulate matter that is at the 0.3 micrometer diameter. And I wanted you to know that I did get my face shields that I spoke about last time, and I've been wearing these outside. Instead of wearing a mask on my face, they enable me to keep a covering over my face when I'm walking fast, and it's going pretty well with it. It's very comfortable, it's easy to see through, and it's less confining than a mask on the face. So I think, instead of wearing no mask at all out there walking, I'm going to try to keep wearing the face shield. So that's what I have on masks today.
I love it. Well, I'm going to stick with this is my Louise Herbert special. right here. And for those that don't know Louise, she's an amazing volunteer, lives in San Clemente, and has made now over 10,000 of these masks. Truly incredible. And, you know, I count me among those that are very pleased to see the president wear a mask today at Walter Reed. Was 3 months too late. But, you know, I hope that that is a signal yeah, wear a mask. I mean, we've known this for months, right? So let's get with the program and let's protect each other and act out of an abundance of common sense and not politicize what is so obvious. So hopefully better times ahead for people wearing masks across the political spectrum. Lonnie in Carlsbad says, I've heard of something called the Patient Protection Act that was passed last week in Congress. What is it supposed to accomplish? And is it going to pass the Senate? Well, Lonnie, what it is, it's actually called the Patient Protection and Affordable Care Enhancement Act. And look, the contrast here could not be any clearer. You've got the administration suing to undermine the Affordable Care Act, which would strip health care for millions of people. In our district alone, over 47,000 residents of the 49th rely on the Affordable Care Act. You've got 130 million Americans with pre-existing conditions whose coverage would be at risk if the ACA were undermined or eliminated. So what we tried to do in Congress with this bill is protect and strengthen the ACA, and specifically what it would do, there's a number of things. Number one, negotiate for lower prescription drug prices, so critically important. Number two, increase the ACA's affordability subsidies. Number three, expand coverage, press Medicaid expansion, hold out states with new carrots and sticks to adopt coverage. Combat inequity in health coverage faced by communities of color. Crack down on junk insurance plans. Sometimes you hear people say, oh, well, we're going to cover you. But if the plan is junk, it's not worth much. We're going to strengthen protection for people with pre-existing conditions, not try to eliminate it. And look, like much of the legislation that the House has passed, it's going to sit on Mitch McConnell's desk and collect dust, which is why it's so critically important that come November that we have not only a new administration, new leader in the Oval Office, but also someone else other than Mitch McConnell leading the way as the Senate Majority Leader. If we have a new person in the White House, we have somebody new in the Senate leading the way, then we can continue our work to aspire to affordable and quality health care for everyone in this nation and protect and strengthen the Affordable Care Act and make sure that we're protecting coverage for those with pre-existing conditions. Thank you very much for that question. Here's a question for you, Doctor, from Kara in Carlsbad. She writes, I am so worried about the upcoming school year for my kids. My kids are going crazy at home, but I'm worried about the spread of the coronavirus. I also am concerned about those parents who work. How are they going to deal with online learning? And Kara, I can relate to that. With an 8-year-old and a 6-year-old at home, my wife and I have exactly those same concerns. Dr. Lacroix?
Boy, oh boy, if there ever was a catch-22, this one has to be it. So during this past week, more so than any time prior, the situation about kids in schools has been entirely politicized. Rather than focusing on what we can agree on, we're focused on political pressure. So the White House economic advisor, Larry Kudlow, on Friday dismissed difficulties surrounding getting students back into classrooms this fall, as you know, in the context of the, more than doubling of coronavirus cases in many states, including our own. He said, just go back to school. We can do that. And you can social distance, you can get your temperature taken, you can be tested, you can have distancing. Come on, it's not that hard. So that's Larry Kudlow, the well-respected White House economic advisor amongst my Republican friends. Trump also threatened to cut off federal funding for schools if they don't open in the fall. The latest stress for schools already reeling from the coronavirus epidemic. He put pressure on the U.S. CDC, saying that he didn't like their guidelines for reopening schools, but it's up to districts to decide the safest course. And Dr. Redfield, who leads the CDC, said they would not be revising the CDC's guidelines. It's important for everyone listening today to know that the CDC is not a regulatory agency. So when they put out a guideline, It's recommendations based on the best science, hopefully. And if state and local authorities choose to follow the guidance, it's really up to them. The issue with the CDC guidance is it would be very expensive to follow, and the schools are suffering from underfunding and not getting much relief, in spite of, I think, the efforts that you've made, Congressman, to get schools relief. So, and in addition, I'm sure you heard that the president issued a executive order or some kind of change to the immigration policy where foreign students, if they're not studying in person, have to go back to the country they came from, even if they're here waiting for school to start again, or they have to change schools and study in person. So they're trying to force colleges to deliver in-person learning, even if, and this appears to be something that would be that would send people back to their home country, even if there was a tremendous escalation in the pandemic. So Dr. Garfien communicated with us this week that he talked to his wife about whether the kids should go back to school or continue to stay home and learn online. And she contributed that the Del Mar School District has adopted an online curriculum and is providing a certification course to teachers who want to teach online next year. She felt that in this case, keeping kids home made sense. She suggested that anyone considering keeping their kids home should talk to their school superintendent about what their plans are before deciding whether or not to keep their kids at home. She also noted that the educational experience in school will be significantly different and possibly worse than online education, given all of the precautions that will be necessary for kids to return to school. So Dr. Garfien and I agree that parents will have to evaluate their personal circumstances about whether to send kids back to school this fall. For example, are the parents themselves in a high risk group? Do they live with or have frequent contact with elderly family members who could catch COVID from the kids? Is the family ready to assume that they and their child could be infectious for the entire time the child is in school? I will say this about the CDC guidelines: even if they're adhered to perfectly, and even if financial issues were not a problem, with infection rates in the 7 to 10 range or even higher, it is definitely the case that children and teachers and staff are going to get infected with COVID. It will increase community spread because there's no way that it can't. And people will end up dying because of going back to school. These are, that doesn't mean we shouldn't do it. It just means that there's no way to make it risk-free. And that's what I mean by catch-22.
Well, thank you for that very comprehensive answer. I was listening intently to every word with an 8-year-old and a 6-year-old at home. And, I guess a couple thoughts. One is that I wish we'd have thought about reopening schools before we started reopening bars and things like that. Maybe we'd be in a different situation. The other is I've had conversations with all of our superintendents and even in a best case scenario, reopening and meeting the ratios necessary, providing the equipment, and doing all the things that need to be done. We're talking the order of millions and millions of dollars per school district. And that's just to do the bare minimum. And at the same time, we're providing them less resources than before because of the economic toll the pandemic has taken. Now in California, thanks to folks in Sacramento having a pretty hard line on K through 12, they haven't seen the draconian cuts, but in some other places they have. So I guess the question is a simple one: is how are we going to expect our schools to reopen or force them to reopen when we're actually providing them with fewer dollars than they had before? It simply isn't sustainable. So I think it's a very tough question because, look, to reopen the economy, of course, we've got to have, child care, and we've got to have schools open for parents to be able to go back to work. So this is something that we're going to be hopefully focused on in the month ahead as we look at our next COVID relief bill. The HEROES Act provides billions of dollars for our schools, additional funding for our schools, in addition to the $875 billion for state and local government. And a lot of that money can go to our schools as well. So I think the critically important thing here is that it's unacceptable, on the one hand, to mandate reopening, and on the other hand, to give no money to do it. It's sort of like what happened with testing, where Andrew Cuomo famously said, if you're going to pass the buck, you better pass the bucks. And I think the same rings true for our schools. Here's another one from Paul in Oceanside. Paul says, former Marine here. We recently learned that Russian military intelligence has been offering bounties to the Taliban in exchange for successfully carrying out fatal attacks on American military personnel in Afghanistan. We also learned that President Trump has known about this arrangement for months and has allowed it to go completely unchallenged. What is your reaction to this news, and what would you say to the Marines and sailors and veterans in our district about it? More importantly, what do you and your colleagues in the House intend to do about it? Thank you for addressing this important matter. Paul, I would consider this appalling. This is an administration where we're frequently shocked but infrequently surprised. In this instance, I was both shocked and surprised because it's one of two scenarios. Either the president didn't read his presidential daily briefing and was ignorant to the advice of his own intelligence community with regard to the lives of American troops abroad, which is horrific, or even worse, he did know about the bounties. He was briefed on the bounties and chose to do nothing. Either way, it's an awful, awful situation, and one that I take extremely seriously. We are demanding additional hearings and investigations to get to the bottom of this. We're going to leave no stone unturned to understand exactly what did the president know, when did he know it, what actions did the administration take or not take on the basis of that knowledge. And unfortunately, there's still a lot that we don't know. The week before we left Washington, I know that the Gang of 8 was briefed. I also know that about 10 of my colleagues went and received a briefing from the White House, which was largely worthless because of who was giving the briefing. People like Ratcliffe and others that really were just doing the political bidding of the administration. So I think the Intelligence Committee and the Foreign Affairs Committee are going to take the lead on getting to the bottom of this, but it's a reprehensible situation, whether it was merely ignorance or something more malicious, we're going to have to find out, but it's troubling, disconcerting either way. Here's a question for you, Doctor, from Luis in San Juan Capistrano. I read something from Andy Slavitt, a former Medicaid and Medicare director in D.C. He said it's more likely that a vaccine won't be developed right away, but rather something more like a flu shot that we'll need to get every year. Is this true?
Well, Luis, that's a really perceptive question. And the Slavitt Twitter string is an interesting read. So I think he's right. He talked to some very knowledgeable people when he was writing that tweet that, the flu shot that we get every year is a vaccine. It's just not 100% effective, and it's not permanent. And the reason for that is that every year the strains of flu that are likely to infect us change a little bit, and they have to tweak the vaccine, and we have to get it again. I don't know if that'll be the case with COVID-19. It has changed a little bit. We heard last week that it's changed to a G strain from a D strain, or the other way around. I can't remember which, but the point is that the strain that is infecting most people now is even more infectious than the strain that was here earlier. So we're looking at a very infectious COVID-19 situation coming through the winter. And one thing that I think everybody does agree on is that you should get a flu shot this year. Whether or not we have a vaccine, everybody should get a flu shot so that if you do get sick with a flu-like illness, it's less likely to be the flu. And people can get both of these infections at once, and that would not be good. The good news, however, and I always like to emphasize that I think there is good news going on out there, is that we've got a large number of potential vaccines that are being tracked. The New York Times tracker had 14 vaccines in phase 1 trials, 11 in phase 2, 4 in phase 3, which is human tests, large-scale efficacy tests, and there's been 1 approved for limited use. The other good piece of information is that Dr. Collins, who heads the National Institutes of Health, and Dr. Fauci said there are a number of multiple vaccine candidates sponsored by the United States entering phase 3 trials at the end of July, August, and September, so right in front of us. And if these vaccines turn out to be safe and effective, they'll be produced in excess to be made available. And this one hurts, Mike. End of 2021. End of 2021 is what they're saying. If no vaccine proves effective, only dollars will be lost, they said. They've got this warp speed program, Operation Warp Speed, and they're expected to name 5 or more vaccine projects to receive billions of dollars in federal funding before there's proof that the vaccines work. They're actually going to make some of these vaccines if they feel good about the phase 3 tests, so that they'll be available as soon as they're approved if they work. I want to reemphasize that we're likely to have a vaccine that's only partially effective and not until the end of 2021. That's a long time from now, and we have to stay the course, and our behavior is everything. So we will get through this, but it's going to be a long haul.
Well, end of 2021, looks like we're going to be doing a lot more virtual town halls,
Yes.
I guess. Boy, oh boy. No, but I'm grateful. I'm grateful for your honesty. Next question from Barbara in Oceanside. A federal judge ordered migrant children to be released from family detention centers due to COVID. The order states the children must be released with their parents or to available, suitable sponsors or other available COVID-free, non-congregate settings with the consent of their parents or guardians. Her question is, what happens when the parents do not consent? How can we make it be required that they are released with their families so this does not become another way that children are separated from their families? Barbara, that is an excellent question. And I'll make sure that we get back to you on this. I think that my number one priority as member of Congress has been to try to keep families together. I think it's absolutely reprehensible that we would separate a child from their parents in the first place. Absolutely heartbreaking. And I would hope in a situation like this that the child could be reunited with their parents. But we'll look into this further for you. Here's a question for you and me both, Dr. Lacroix, from John in Solana Beach. I tried to get an appointment for a COVID test through the county yesterday, and the closest location is National City. And I can't get it for 2 weeks. What happened to the USD, Oceanside, and Escondido locations? They weren't even an option.
Well, if you'll let me go first, I can.
Please.
I checked that out. I went to the website of San Diego County today and tried to get myself a test and was not able to get signed up anywhere. So even as California conducts a record number of COVID-19 tests, and we saw that Orange County did 7,000, and I think San Diego a similar number, the resurgence in cases has driven more people to ask for tests, overwhelming test sites, creating fear among officials that supplies will run low, and creating a bottleneck in a system that has taken us months to build up. So they're reporting on this in the news. They just disbanded the state's testing task force, which was a bummer to learn. I don't know why they would do that. Maybe they thought they conquered that, and only to be overwhelmed right now. San Diego Health and Human Services Director Nick Macchione said wait times are around 5 to 7 days, but they're not letting you make an appointment unless it's within 7 days. So I wasn't even able to get, after filling out the form, it's 2 pages. So I wanted to call on Molly, though, because I think our best defense for getting tested is through our healthcare provider if we're lucky enough to have healthcare. Can you describe your experience getting tested this week?
Yes, so I am a member of Kaiser Permanente, and I was able to get a test today after a exposure through my partner who works with Orange County Fire Authority. I think that this just highlights the disproportionate ability for people to get tested. Because I'm fortunate enough to have healthcare. I didn't have to go through the CVS system or call around. I was able to speak to a nurse, have a doctor call me back and put in my order, even with with no symptoms today. And so again, I'm fortunate. And this also highlights, I represent workers that work in the healthcare field at Tri-City Medical Center as well. And our members cannot get tested by their employer unless they go into the ER exhibiting symptoms that way. They have to go to their own provider. And so this also creates a problem where people are essential workers and our frontline healthcare workers don't have access to tests. And I don't think that this is the fault of the actual healthcare providers and the hospitals. I think this is just part of the failure of our administration to really have a test process in point that makes testing accessible to everybody.
Well, Molly, I hope you and your partner are all right. And, to the original question, it's completely unacceptable. And what I will do is we'll make sure that we flag this for our official side, and we will try to find out what's going on. We've got great relationships here in San Diego County with our public health community, and we'll try to see why that is. And just the same, we can try to contact the governor's staff and understand why they decided to not continue with that testing task force. What I would say to you both and to our viewers is how disappointing it's been that our administration has really failed to lead on a national comprehensive testing strategy. And we actually required that they produce one. Back on May 24th, we passed an interim bill, middle of May, for $400 and almost $500 billion, which included $100 billion for hospitals and for testing. Part of that was that the administration would produce a national strategy. And what they produced was an 80-page PDF. Basically, the first half of it was touting their accomplishments, and the second half was punting to the states. There was very little in there in terms of an actual comprehensive strategy. Instead, we've allowed all 50 states to sort of compete and fight one another for very limited supplies, whether it be swabs or reagents or anything else. And that's no way to run a national strategy. The other, I think, really false and damaging information is somehow the notion that if we test more, that's a bad thing. Harvard and others have said you need 152 tests per 100,000 people per day minimum in order to try to get your hands around the extent of community spread and to try to treat and isolate. And to say, well, we've got more tests and that's why we've got more positive cases. I would reiterate, Orange and San Diego County. San Diego County has been testing considerably more than Orange County. Orange County has a far higher positivity rate. The positivity rate is really what matters rather than the number of tests that you're running, certainly not in a vacuum when that positivity rate is so high. So we'll follow up on this question from John. Here's a similar one, and this one's perhaps even more concerning. It's from an anonymous frontline healthcare provider at a hospital here in the district. They asked that we not use their name or the hospital. But they said, I'm a healthcare provider for a local hospital. We routinely treat COVID positive patients. However, we are not allowed to wear PPE if we are treating patients who have not tested positive. Several of us have recently treated patients who were subsequently admitted to the hospital. They were then tested and were positive. When we asked if we could be tested, we were told that we could not get tested at work. And if we develop symptoms, we need to go home and quarantine. If we were able to get tested regularly, asymptomatic or otherwise, it would put us and our patients at way lower risk, not to mention our families we come home to every day. That's just stunning. And I'd appreciate maybe Dr. Lacroix, if you wanted to address that, and then Molly, if you wanted to address that as well.
Well, I was horrified, to read this question, and as an occupational health, public health person, find it completely unacceptable. At UCSD, in contrast, we're testing every single healthcare worker, regardless of their symptoms, every month. That's just the baseline. And if any staff member, including people that have no contact with inpatient or outpatient people that may be COVID infected can ask for a test and get tested within a very reasonable amount of time. So I don't understand why a healthcare organization would want to put its workers in harm's way like this. Molly, do you have anything that you can tell us about why that would be the case?
Yeah, so I want to comment on two things that were said here. One was the comment about not having PPE provided, and our union, SEIU United Healthcare Workers, recently partnered with Senator Connie Leva and as well as Senator Dr. Pan, who have co-sponsored the SB 275 bill. It's the Healthcare and Essential Workers Protection Act, which will require both California as well as healthcare providers to have a 90-day stockpile of PPE. There's no reason why healthcare workers should not have access to adequate PPE. And I believe, again, this is a fault of our administration for not using the Defense Production Act and making sure that we are coming together and organizations aren't fighting over access to PPE. So that's the first thing that we are leading on within the state to make sure that California is prepared for all of this. The second, as far as testing goes, is, again, I think this comes down to a matter of resources for different hospitals. A hospital like UCSD, for example, has far more financial resources than my hospital, Tri-City Medical Center. We received $5 million under the CARES Act, whereas Stanford Hospital received about $120 million. And so when hospitals are just trying to keep their doors open, they unfortunately are limited in being able to afford to test, be able to compete for the PPE and these sorts of things. And it's totally unacceptable what's happening. And again, it shouldn't be a requirement to have money to be able to be safe during these times. And again, I'm happy for any healthcare providers to reach out to me personally. I'll give my email address on here as far as anything that has to do with PPE or anything like that that's happening in California, because there may be a chance that they work at one of our hospitals that we represent, and we're happy to do the work necessary to advocate for them.
Thank you both very much. I want to make sure we get to the medical questions that we've got in the time that we have remaining. So I'm going to jump right to the next one. Here's another question for Dr. Lacroix from Kimberly in Oceanside. The number of infections is obviously climbing, but the number of deaths don't seem to be climbing in sync. Is that because our medical experts have gotten better at treating COVID-19 patients?
Well, thank you, Kimberly, for that question. I want to start by saying I do think our medical experts have gotten better at treating COVID-19 patients, but I'm sorry to report that it's no longer true that the death rate is not rising. So more than 4,200 deaths were reported nationally in the past 7 days. We're up around 137,000 U.S. deaths from COVID. The states, Texas, Arizona, South Carolina, have all seen their death toll rise more than 100% in the past 4 weeks. And 4 more states, including our own, plus Mississippi, Tennessee, and Louisiana, have seen at least a 20% jump in that time span. What I think, unfortunately, explains the lag in COVID deaths is that we were enjoying a low death rate from our shelter at home period. It takes about 2 weeks from the time our behavior changes until you can see the number of cases go up, another 2 weeks until you can see the hospitalizations go up, and then another 2 weeks until you can see people on ventilators and the death rates start to go up. So it's a 4 to 6 week kind of cycle that we're in. I never thought the death rate would stay lower, unfortunately, although I'd like to be wrong about those things. So we are going to see a lot of deaths from the behavior changes that started on Memorial Day and that are continuing. And we'll keep telling you about them, but our behavior can turn that around. And just the way that it turned it up, we can turn it back down.
Thank you for that. Here's another one from Klaus in Del Mar on the subject of face masks. There is more and more scientific evidence that even the most primitive face masks hold back 90% of infectious droplets. When 2 people meet and both are wearing face masks, the risk of infection is reduced by 90% times 90%, which is 99%. They thus have a 1% risk of infection compared to unprotected people. Asians have known this for decades and therefore practice it. Europeans learned it recently and practice it. Why don't we understand such a simple principle as a nation?
That sounds like a happy hour question, but or a sad hour question, but let me give you my answer. Number one, misinformation, which was what I talked about in the opening statement. We were not clear about the value of masks because culturally in the United States, masks worn by the population at large were not a thing here until COVID, not since 1918 and the flu pandemic. So even Dr. Fauci was really ambivalent about whether he should recommend masks at the beginning of this. So that created some confusion. Number two reason, the politicizing of the use of face masks. Real Republicans don't wear masks. And then you can extrapolate from there. The idea that executive orders to wear a mask is un-American because we live in a free country is another issue. I'm going to say Tulsa, and I'm going to say Mount Rushmore. I'm going to say the Republican National Convention. All of these places under the banner of American freedom and liberty, which we all endorse and stand for. They're saying that everyone should have the choice of not wearing a mask because we live in a free country. Denial that COVID is a problem at all because the president says it'll go away by itself. And it's not a problem for 99% of the people who get it, all of which is a lie, just a bold-faced lie right into your face by the president of the United States, who until today would not be seen in public wearing a mask, and even then only wore it in a hospital. That's number two. So the politicization of use of face masks has been a huge problem for all Americans to come together on this issue. Number three, lack of compassion for others. I think that people see this as something that would protect others from me, and they just don't value that, some of them. And number four, fatigue. And I just want to read, wearing face masks is not fun. I just want to read a little couple sentences from an Atlantic article that that Ellen passed around a couple of weeks ago. This is what it said. Let's be real. Americans are beat down and run down after months of loss and social isolation. Masks do keep people from seeing facial expressions and hearing voices clearly, both vital elements of social connection. Masks don't deprive people of oxygen, but they do make it harder to breathe freely. They fog up people's glasses. They make noses itch and faces sweat. Many masks feel decidedly uncool. They are yet another thing to remember when walking out the front door. And most of all, masks are a constant reminder of what Americans so desperately want to forget, that despite all of our sacrifices, the pandemic hasn't gone anywhere. I think that says it all. It's hard to keep wearing these, and yet it's that behavior and a few others that we've mentioned multiple times that are going to enable us to get through this. So, basically we have to endure, we have to suck it up and wear these masks so that we can get to the end of the pandemic, get to 2021 when we have some vaccines, and don't lose 1 million Americans between now and then.
Very well said, Doctor. Let's be smart. Let's treat each other with respect. Let's show common sense. And as I've said before, the virus doesn't care if you're a Democrat or Republican. The virus is going to do what it's going to do. So wearing a mask is about as simple as it gets. Here's another one for you. and this is from Joaquin. PCR tests have 30% false negatives, while using CT scans have a much higher accuracy and people can get the results right away. How can we add more CT scan testing? Do you know any places that are doing this in the U.S.?
So, Joaquin, thank you for that question. That was kind of a new one on me. I didn't know that anybody was saying that CT scans could take the place of qPCR testing for COVID. But I want to say a few things about it. Imagine if instead of getting a nasal swab, you had to stand in line to get a CT scan in the hospital. This is extremely expensive. They expose patients to a low dose of radiation in the scanner, and some medical groups actually recommend using them to diagnose COVID-19 for these reasons, and the fact that you'd have to also, if infected people were in the scanners, you'd have to be careful not to transmit the infection from one patient to another. A couple other things to understand is that These scans are being used inside the hospital if people seem to have COVID symptoms but are not testing positive. They'll use a CT scan to make a diagnosis, and that's helpful. But what they see on the scan is this hazy, patchy ground glass finding in the lungs, which is a telltale sign of COVID-19, but also a telltale sign of other viral pneumonias. It's not a specific thing that you see on the CT scan. So it's helpful in the hospital. They did use them in China when they were in the worst of their pandemic to do diagnosis. I can't imagine that we would be doing that here, but there are some hospitals already using them. And I'm guessing that most of the hospitals are using them when they need to confirm a diagnosis. I just don't see them being practical or affordable, given all the other things we've talked about today that we need money for. Very important things, taking the place of much less expensive mass testing with qPCR.
Another one for you, Doctor, from Mary in Rancho Santa Fe. Mary says, I read that certain blood types can determine who is susceptible to the coronavirus. Is this true?
It does seem to be true. That's straight up epidemiology. And there's a paper that came out in April of 2020 from two doctors, Zietz and Tatanetti from New York Presbyterian Hospital. And what they found was, I'm going to give it to you with numbers. You can always count on me for the numbers. Blood groups A were associated with an increased probability of testing positive for COVID-19, a 34% increased risk of testing positive if you're blood group A. Blood group O was associated with a decreased odds of testing positive, a 20% decreased odds. Few individuals with AB blood groups are available to include in this study. But they did find that AB blood groups were associated with a very decreased odds of testing positive, so like a 44% decreased risk. And when they tested individual ABO plus RH groups, putting both of those variables in the data, they discovered strong associations were only found in the RH positive blood groups. So there's a lot more to learn. This blood group situation, like why would this be the case? Maybe we can learn something about prevention of COVID overall from better understanding it, but you're onto something with the blood group associations.
Thank you for that. And thank you both so much for being with us today. I thought this was really an incredibly informative town hall, and I want to give you each an opportunity for a closing statement. And Molly, since you went first with the introduction, I'll let you go second. Dr. Lacroix, what a week it's been for COVID-19. What concluding thoughts do you have this week?
I guess I want us to be out there carrying forward the message that everything that's going to happen in this pandemic is being related to, is relatable to our behavior. It's not just being thrust upon us. Our behavior is determining it all. Therefore, we have the power, we have the capability to decide what direction this goes. And I encourage us, like I always do, to care about each other. And the sweetest thing I saw was on our own campus, an undergraduate was interviewed during the return to learn activities to see if we could bring students back to campus safely at UCSD. And she said, now's the time to care about each other. And that's why she got tested. So if we're going to be out and about there, and I do think we can be, we just have to do the things we need to do to not pass this around with each other. So with that, I wish you a much better week than this last one with respect to COVID news. And Molly,
take it away.
Thank you again for having me on today and allowing me to learn so much from both of you and the work that's happening. And I really just want to echo what Dr. Lacroix says, that the solution for COVID is also the solution for racism. And that's, we just need to care about each other. We need to care about people and the experiences that they're having. And so for those of you that joined today and are interested in getting more involved with the movement for Black Lives, I ask you to reach out to Encinitas for Equality. You can connect with us on our Instagram, Encinitas for Equality, our Facebook group, Encinitas for Equality, or send us an email at encinitasforequality@gmail.com, and we can connect you with either our group, or if you're not in the area, we are working in partnership with a number of other groups that have been leading on racial justice, and we can connect you with that. And in the upcoming week, we'll be having, if you're local, we'll be doing a Chalk for Justice event at the Cardiff Kook on Wednesday. It's family friendly. We will be masked and social distance. We'll be showing movies in the park, Aca and the Bee, starting on Friday night, because we want to make sure that our children and our families see representation on the screen of all cultures and communities. And lastly, as previously mentioned, we'll be having a large event June 25th at Moonlight Beach. And so, and the last thing is every day, 8 a.m., we meet at Lucadia Oaks Park to run for Breonna Taylor and to continue to put pressure and make sure that we demand justice for Breonna Taylor. And so we run, walk, skate, bike, whatever works for you. People can come out and join us. And the most important thing that everyone can do is get registered to vote and make sure that we vote in November. Thank you.
Well, thank you so much, Molly. I'm so grateful to you for all that you're doing in our community. And to both of you, thank you for your leadership. Thank you for your advocacy. And thank you for sharing your knowledge with our audience. I hope, as I said, that this was a worthwhile investment of time. Now our 30th virtual town hall since the middle of March. And I just hope everybody is staying healthy and safe and following those guidelines. We all know what they are, and many of them are quite simple. So let's take care of one another. You know, as we've said, whether it be the importance of confronting COVID or the importance of confronting racial inequality, the only way we're going to get through this is if we start listening to each other, start helping each other, advocating for one another, and trying to help those most who need our help in our communities. And I think better times are ahead if we're able to come together. I know we can do it. So let's get out there and let's try to make next week better than this week. And with that, I thank you for watching, and we'll see you very soon. Take care.